Nearly 270,000 people die from sepsis each year. Many sepsis cases develop from infections acquired during healthcare treatments. The World Health Organization estimates that 70% of these infections can be prevented. Utah Valley Hospital needs to focus on minimizing healthcare-associated infections through new technologies and better practices. We will go over a few ways that this can be achieved in this video. Various types of healthcare-associated infections, or HAIs, plague patients throughout the country, ranging from MRSA, central line-associated bloodstream infections, catheter-associated UTIs, surgical site infections, C. diff, and ventilator-associated pneumonia. All of these infections can lead to sepsis and death. In American hospitals alone, the Centers for Disease Control estimates that HAIs account for an estimated 1.7 million infections and 99,000 associated deaths each year. According to the CDC, 1 of every 31 hospital patients and 1 of every 43 nursing home residents develop an HAI. These decrease the quality of care that patients receive, as they are now being treated for something developed while treating something else, as well as decreases their trust in healthcare providers. Utah Valley Hospital was the only hospital with higher than national average rates for catheter-associated UTI rates for 2021, having 19 reported cases. In all other HAIs, Utah Valley Hospital ranked at, or below, these national averages. This is a huge cost for the hospital. HAIs in U.S. hospitals have direct medical costs of at least $28.4 billion each year. For each incidence of an HAI, the hospital care cost of a patient increases by $10,375, and it increases the length of stay by 3.3 days per patient. This equates to an additional $12.4 billion in indirect costs to society from HAI, from early deaths and the loss of productivity. Surgical site infections are both the most common type of infection and the most costly, accounting for 31% of all hospitalized patients. C. diff and surgical site infections account for 79% of the cost of HAIs in the U.S. Luckily, C. diff numbers have declined since 2020, especially at Utah Valley Hospital. All other HAIs have increased from 2019 to 2021, according to the National Healthcare Safety Network. Preventing these infections through new technologies is vital to the success of any healthcare agency and should be a huge area of concern for Utah Valley Hospital, as it will improve patient care and decrease patient costs. Artificial intelligence, AI, for sepsis detection. Sepsis is a severe condition that affects millions of people worldwide each year, and nearly 270,000 adults in the United States die as a result of sepsis annually. Therefore, it is crucial for healthcare facilities to identify sepsis early on and prevent deaths. To address this issue, we recommend that Utah Valley Hospital turn to artificial intelligence for assistance in detecting sepsis early and preventing death. AI can be used to analyze large volumes of patient data to identify patterns and risk factors associated with sepsis development. By doing so, AI algorithms can alert clinicians when a patient's condition meets the criteria for sepsis, providing timely intervention that could save lives. AI technologies have improved rapidly over the past decade. This improvement is largely driven by advances in machine learning. Because of this rapid rate of advancement, there is widespread speculation that AI will soon have a much larger impact on healthcare than currently seen. Artificial intelligence has great promise to help medical providers and facilities improve quality of care and ultimately health outcomes of their patients. However, adoption of AI in healthcare has been sluggish, according to a Brookings Institution report. Despite the slow adoption of AI technologies, a recent survey revealed that 85% of healthcare executives have an AI adoption plan. As written in Health Tech magazine, we're at the point now where if you're not investing in AI, or if you're on the fence about investing, you're going to be left in the dust. New efficiencies in data analysis speed and accuracy have major implications to cost of care, quality of care, and shorter waiting times. Additionally, AI identifies patterns and is generating insights that might not have been discovered by medical providers. This pattern identification not only allows a medical provider to offer top-tier, reviewed consultation to their patients, but also assists in medical research and discovery, further adding to its value and the possibility of reduced patient costs and heightened healthcare quality. Researchers at Healthcare Dive estimate that broader adoption of AI nationwide could lead to savings of 5 to 10% of healthcare spending, or up to $360 billion a year. Effectiveness of AI in detecting sepsis. Several studies have demonstrated the effectiveness of AI in detecting sepsis early on. One study published in the Journal of Critical Care found that an AI-based sepsis detection system reduced mortality rates by 40% and hospital length of stay by 25%. Another study published in PLOS One found that an AI algorithm had a sensitivity of 89.6% and a specificity of 97.8% in detecting sepsis. The studies indicate that AI-based sepsis detection systems have the potential to significantly reduce mortality rates and hospital length of stay. Machine learning algorithms for sepsis detection. Various machine learning algorithms, such as random forest, C5.0, decision trees, boosted logistic regression, SVM, logistic regression, regularized logistic, and Bayes generalized linear model, have been used to develop predictive models of septic shock. Among them, the random forest algorithm performed the best, with an AUROC of 0.9483, a sensitivity of 83.9%, and a specificity of 88.1%. Gradient enhancement algorithms, such as XGBoost, have also been used to develop septic shock prediction models by combining physiological data in air with features obtained from natural language processing in clinical medical record data. There are several ways in which AI can be used to detect sepsis. One approach is to analyze vital signs, such as heart rate, respiratory rate, and blood pressure, along with laboratory results and other clinical data to identify early warning signs of sepsis. Another approach is to use machine learning algorithms to identify patterns and risk factors associated with sepsis development. Utah Valley Hospital can implement an AI-based sepsis detection system by integrating its electronic health record system with an AI platform designed for sepsis detection. The EHR system would provide the necessary patient data to the AI platform, which would analyze the data and generate alerts when a patient meets the criteria for sepsis. The alerts would be sent directly to the clinician, providing timely intervention and reducing the risk of patient mortality. By adopting this new technology, Utah Valley Hospital can increase patient satisfaction by providing quick and accurate results, reduce wait times within the clinic, and decrease both patient and hospital costs.